Well, the Alabama Rural Health Investment Program is off to a great start. The program reached its $20 million tax credit cap in just 1 month. This program, which was approved in the 2024 legislative session, looks to improve the financial stability of rural health hospitals such as Dale Medical Center by encouraging donations. Financial stability is a big part of the fight for hospitals to stay open here in rural Alabama, with several closing their doors over the past few years. Dale Medical CEO and Alabama Rural Hospital Association board member Vernon Johnson says the support has been overwhelming.
I think it speaks volumes in how people recognize how vital our hospitals are to their communities. Access to care can be a matter of life and death. And so it's very vital that we maintain the healthcare safety net that we have by having access to care evenly distributed around our state through our rural hospital system.
As for what's next, the Rural Hospital Association hopes the cap can be increased to help more hospitals.